Our next speaker will be Siddikur Rahman. He's from Department of Medical Microbiology, from Thailand University, Bangladesh. So he will talk about his practice in people's knowledge, attitude, and practice regarding climate change and dengue fear. So let's welcome Siddikur.
Easy, I guess. Or is that eager? Any questions?
Swedish, right?
So you have 2 minutes and 5 minutes.
So, a very good morning to all. I'm very pleased to present my research findings here. So, welcome to my presentation in the title of Disparities in People's Knowledge, Attitude and Practice regarding Climate Change and Dengue Fever in Laos, People's Democratic Republic and Thailand. So, before starting my presentation, I want to have my introduction with you. I am Siddikur Rahman. So, I am doing my first year PhD study in Homogeneity University, Thailand, and I am a PhD research fellow from Research Council of Norway. So I am working in a project also. The project name is DENCLIM. So in this presentation, I am going to discuss some of the themes. In the outline, you see the topics. So in the background section, I am going to discuss about the global burden of dengue fever with the climate change. And the major dengue outbreaks has been occurred recently in 2019 in several countries, and some things about the dengue virus transmission cycle, how it occurs or transmitted between human to mosquito, mosquito to human, and the current status of dengue mitigation. Then rationale of my study, objective, specific hypothesis, study design, and finally findings with concluding remarks. So this is the background, you see. Dengue is a climate sensitive and one of the most important arboviral diseases in the world. And climate change, there are many factors affecting the dengue transmission, but climate change is one of the most significant driver of dengue transmission. So exactly there is no exact burden of the dengue estimate, but we have got like estimation of 4 billion people. That means that if you consider the world population, half of the total population is in risk of the dengue transmission. So nearly 390 million people are getting infected annually, out of which only 25% manifest clinically, and the yearly mortality figure is greater than 20,000 for the dengue fever. So these are some of the recent outbreaks in several countries in 2019, that is the current year. You see, China is also experiencing some of the dengue outbreak, but it's not too much. In the eastern part of China, I think dengue is occurring right now, but the death rate is not too much, so I did not include China here. But if you go, the statistics behind China is also suffering from dengue disease or dengue fever. So in Philippines, you see Malaysia and Sri Lanka and my country, Bangladesh, is suffering a lot from dengue outbreaks. So you see the death rates, Philippines is the highest death. So this statistics is like the July, August, and October. So Philippines already 461 deaths has been reported or occurred. In Bangladesh, is still a very large number, but due to the lack of the data availability, I consider only October, but this date is 81. So what's about Thailand and Laos? Yeah, because my study area in Thailand and Laos. In Thailand and Laos, the major outbreaks has been started in 2010 and is continuing in 2019 as well. So in the 2010, the deaths had been reported 139. In 2013, it decreased a little bit, but not too much, it's 136. In 2015, the death has been increased also to 148. And what's about the current year? it's already 30 deaths has been occurred all around the Thailand. So what's about the Laos? Laos, 46 deaths has been recorded in 2010. That means this is the major outbreak. Then 2013, it's almost double. And 2019 is also a major outbreak. And as of July, 33 deaths has been already recorded. So this data from the Ministry of Public Health from two respective countries. So I want to have a little bit about the transmission cycle of dengue fever, how it's being transmitted from mosquito to human and human to mosquito. You see, dengue is a virus and it has a 4 serotypes, 1, 2, 3, 4, and 5. And right now, some people say serotype 5 is being occurred, but still now it has not been invented. So yeah, so you see the transmission cycle from mosquito to human, human to mosquito. So this transmission cycle, climate change plays a major significant role. So when the egg of the mosquito is come out, then the egg converted into the larva stage, and this is the larva stage, and fifth stage is the pupa stage. So after the pupa stage, it got the adult mosquito. So this transmission, like the mosquito transmission, and the mosquito proliferation, or the mosquito development, or you can say the offspring generation, climate change plays a significant role over there. Like specifically humidity, many studies showed us that humidity, rainfall, and temperature has a significant effect on this mosquito proliferation. So this is the relationship you can assess or quantify the climate change impact on the dengue fever. Yes. So what are the current status of dengue mitigation? Still now, there is no effective prevention of dengue fever because some vaccine has been prevented, like the name of the Dengvaxia, but it's still no longer effective, like the question about the efficacy of the drug, and many people die, like the Philippines use this kind of Dengvaxia vaccination, but the prevention mechanism is not good enough, so many people die. And this vaccination has some limitation also. You know, dengue is a virus of 4 serotype, but this vaccine is useful only for serotype 2. So what's about the other serotype? So still now, there is no specific drug. Also, there is no effective vaccine. So what should we do? So we should be focused on the vector control, that means the mosquito control. We should focus on the personal hygiene. So these are some of the pictures that you can take into consideration for the dengue mitigation, and for that, climate change is also has a significant effect for this mitigation problem as well. So what is my rationale of my study? So the rationale of my study is, as far no study has been studied to assess the CAP means knowledge, attitude, and practice of the people regarding climate change and dengue fever together. Many studies have been published only for the dengue fever, but they did not incorporate the word climate change here. So we incorporate the climate change with the dengue fever, knowledge, attitude, and practice. And yeah, we have to find the significant differences of their CAP knowledge between urban and rural setting. So based on the rationale, I want to show you my specific objective. The first objective is to determine the knowledge, attitude, and practice about the climate change and dengue fever. And the second objective is to modeling the determinant factors. That means their knowledge, attitude, and practice is good or poor. What factors affecting this status of their knowledge, attitude, and practice? So I tried to model it out about these two things as well. So the hypothesis will be mainly I want to compare this setting with two countries, Thailand and Laos, with urban and rural setting, also with population with different socio-economic status. So in my study design, before go to my details analysis, I want to introduce with my project details. So I'm working in this project, DENCLIM project. You see, the project has several objectives are here. So most of the objectives related with the environmental impact on the dengue transmission. So if you consider the objective specifically, we have the retrospective characteristics, and based on the retrospective characteristics, we want to predict the future scenario, that means prospective. So we have two objectives mainly, retrospective. Based on the retrospective objective, we want to go for the prospective study design. So in our study area, you see the Mekong River, Mekong sub-region, dividing the two countries. So we selected total 8 study area, 4 study area in Laos, 4 study area in Thailand. So total we have selected 720 households from this 8 study area from Thailand and Laos. So then based on the household, we will focus on many, you see the many survey we're gonna proceed. The name of the survey is like, first we already finished the CAP study about the dengue and climate change. Then we will of course conduct a seroprevalence study, taking the blood sample from each household, but we reduce the number of households here due to some of the problems like the blood taking problems, because most of the people does not allow us to give the blood. So we reduce the number of households here, and the retrospective study you see. So we use the historical data as well, like the 20 years data, meteorological data from Thailand and Laos, with the dengue cases, the dengue outbreaks, we already collected from the Minister of Public Health. Then we're gonna assess and quantify the modeling of the meteorological effect or incidence on our dengue transmission. And also from our data, we're gonna predict as well. So we want to see the vulnerability and risk factor study based on the retrospective study, including seroprevalence, socioeconomic study, CAP study, entomological survey as well, and finally weather study. We put the weather station already, so we are getting the daily minimum temperature, rainfall, every data from there. So the prospective study will be like the forecasting, like it will be started on the 2020 up to 2050. So the prediction based on the retrospective and current studies, including future scenario of adaptation and mitigation of climate change as well. So we wanna mainly use like the dengue risks due to climate change based on IPCC, or comparative vulnerability mapping, the land use, land cover. So this is a huge study we're gonna proceed. So based on the, still now we have finished 2 survey, CAP study and the household survey. So I just presented my result from the CAP survey, and I prepared one of the manuscript based on this result. So let's proceed for my thing. So for this analysis, I used really 2 survey. One is the CAP survey, and another is the household survey. So this CAP survey and household, mainly CAP survey is related with the climate change and dengue. So we made some basic question to the respondents of the household. So this is a cohort cross-sectional study. So in the study, we question about the climate change adaptation and mitigation knowledge, their attitude or awareness or practice with the climate change adaptation and mitigation, correlating with the dengue, like the dengue, normal dengue symptoms, then the vector entomological things, like the vector surveillance or the vector breeding site, about the vector breeding capability, something like that. So based on this survey, I assessed the CAP, their response from the knowledge, attitude, and practice. Then I identified 2 groups actually, whether they have a good or poor knowledge, attitude, and practice. So these 2 dependent variables. Then finally, I went over the modeling. So I used the principal component analysis for socioeconomic status indexing based on some of the asset variables. Then I used the chi-square test of independence, logistic regression, and finally multivariate cluster analysis. So these are some of the techniques, statistical techniques I used for this result I'm going to show you. So these are the findings. So first finding, the first table show you the demographic and socioeconomic characteristics of the respondents. So this table is a huge table, is difficult to understand. So I want to summarize this one. So there are many variables here. So I just categorize our study site into urban and rural. Though our study areas are total 8, but I categorize this 8 study area into 4 study area, like 1 urban from Thailand, 1 urban for Laos, 1 rural for Laos, 1 rural for Thailand. So these characteristics of the study population is correlated with the mean score I have calculated from their knowledge, attitude, and practice. So if you take a careful look over the table, you will see the mean score is higher for the urban people. The mean score is higher for the less age group, that means less than 30. Sex is not significant variable here, but marital status also not significant variable is here. So I found the significant differences between urban and rural areas. That was one of my objectives, and the differences were found also as far as the demographic and socioeconomic factors and their knowledge, attitude, and practice level of climate change and dengue as well. So this is the continuation of the previous table as well. There you will find the significant differences in the highest level of education they have attended. Also the type of resident, socioeconomic status, and previous dengue experience. So this is also one of the significant variables for the dengue knowledge, attitude, practice, but this is not significantly associated with the climate change knowledge, attitude, and practice. So yeah, urban communities have a greater mean knowledge than the rural community in Thailand and Laos. So then I try to find the predictors of climate change and dengue knowledge, attitude, and practice level. So I categorize two levels like good versus poor. Then I use the logistic regression model. So this is complicated somehow. So I want to summarize. So this is the knowledge level of climate change and dengue. So I separately put. So you see, so urban status is significantly affecting the knowledge level of climate change and dengue fever, and age group is significantly associated, sex is not, but highest level of education is significantly associated, and socioeconomic status is highly significant variable is here, and previous dengue experience is significantly associated with the dengue knowledge, but it is not significantly associated with the climate change knowledge. So second table I try to show about the attitude level, the same mechanism I have used here. So I have used the respondents number is 719, and one household we could not interview due to the availability, maybe they transferred to another city. So yes, the same thing is repeating here. Urban study site has a significant effect here, and sex of the person is significant for dengue, but not for climate change. Then highest level of education, socioeconomic status, and previous dengue experience is somehow significant for the attitude level as well. And for the practice level, study side is significant, and highest level of education, socioeconomic status, and previous dengue experience is significantly associated with the dengue, but not with the climate change. So it's a huge table. So I want to summarize like the factors associated with good knowledge, attitude, and practice where urban residents, where they are the urban residents having higher education, high socioeconomic status, and previous dengue exposure. So I also try to see the correlation. Also, I try to find the correlation between their knowledge, attitude, and practice, and I found the correlation between their knowledge, attitude, and practice was positively correlated. That means who has a good knowledge, they seems to have good attitude. Who has a good attitude, they seems to have a good practice. But some relation is strongly associated, but some are not strongly. But all the correlation are positively correlated. So somehow this is correlated with knowledge, attitude, and practice, or you can reverse in another way. Yeah. So yes, I found a significant positive association between gaps regarding climate change and dengue. So finally, I tried to show the homogeneity because my title suggests you to the disparity. Now I want to show you the homogeneity. So it's I think the same concept. So the homogeneity among the study population in terms of the cap characteristics I considered so far. So you will see the homogeneity. So I use some of the graphical techniques are here. So for the dengue knowledge, attitude, and practice, you see that heat map show you. I have found that two clusters. That means urban Thailand and urban Laos are somehow homogeneous based on their knowledge, attitude, and practice regarding dengue. This is the climate change, and the same plot. This is the validation of the heat map, nothing else. The cluster plot shows the same result. So yes, and the second graph show you the homogeneity among the study population as per the dengue knowledge, attitude, and practice. So in the dengue knowledge, attitude, and practice, I found rural Thailand, rural Laos, and urban Laos make one cluster. That means these three study area have the homogeneity as far as their knowledge, attitude, and practice regarding dengue. These are the three clusters I have found. So about the dengue or dengue knowledge, attitude, and practice. So I want to now is my concluding remarks. So despite the effects of global warming, local climate change, and rapid expansion of the dengue incidence in Laos and Thailand, and knowledge, attitude, and practice of people about the climate change and dengue were low, except but their attitude level was good, but knowledge and practice were not good enough. And compared to the people in the urban, rural people were found to have lower knowledge, attitude, and practice level regarding climate change and dengue. Though dengue is considered as the urban disease, but we see the rural people are more concerned. But you cannot do anything with the God-gifted things like the climatology things. So that's why climate change is affecting this dengue transmission a lot. And the findings call for urgently needed integrated awareness program. That awareness program will increase the cap levels regarding climate change adaptation and mitigation. Also, it will help the general people or affected people of Thailand and Laos to improve their health and welfare. Yes. So these are the team members. We are working in Thailand and Laos. So the one lady is also here. She's working in the AIT in Thailand. He's a remote sensing specialist. So I'm the medical microbiologist, and she's the meteorologist. So we are working together with some of our supervisors. So I'd like to thank all the project partners in our DENCLIM project. So if you are interested enough, you can contact our SARs, like some of the lead epidemiologists are working here. You can contact or write the name of the DENCLIM project. You can contact. So Dr. Hans is the main PI project investigator of this project. He's living in Thailand with me. He's originally from Norwegian University of Life Science, and he's an entomologist. You can contact with that also. So so finally I'd like to thank you this conference. If you have any question, I'll be so glad so I can improve my manuscript. So your question will be highly appreciated. Thank you very much.
So thank you, Siddikur. So very powerful speech about people's knowledge, attitude, and practice related to climate change and dengue fever. So also especially show the difference between people, especially also among the people from urban and northern area, different divisions. So some questions? Yeah. Please.
Go ahead. Sorry, I have a quick question. I may have missed it. That you mentioned an awareness program. Is that? I mean, you mentioned the need for it. Is it in place yet, or is it being developed, or is it?
Also, I did not consider some of the questions are here due to the cleaning of the data. Like we also perform some of the survey, like the social media interaction. How social media is playing to increase their knowledge, attitude, and practice. So we already collected the data, but we did not publish yet. So we have a plan to show the actual statistics of their intervention strategies, what kind of internet facilities they have, what kind of social media they are using. So we did not find any high percentage linking to climate change news and dengue news. So the government can implement social media interaction to increase their level of cap.
So it is not there yet. You say
No.
Okay.
There is no publication. In fact, we did not find anything. So this is our thing we can adopt, we can employ the new things like the social media intervention to increase the cap level of the climate change and dengue.
Thanks.
I'm just curious about, so you're mentioning climate knowledge. If you can tell us more about the questions you ask this household and
Yeah,
what
so
is good
it would be
knowledge?
good for you also if I presented those questions here, but I want to share with you some of the questions like climate change. So I start with the question like, did you ever heard about the climate change? So this is the first question we ask, right?
Yeah.
So what is the previous pattern of the rainfall here? Did you experience any rainfall in the last year? Because we correlate the question with the previous dengue outbreaks. When the dengue outbreaks occurred, so what his knowledge is about the temperature, what his knowledge is about the humidity, what his or her knowledge about the rainfall pattern, so and the drought also and the flooding. So what kind of knowledge he has, and did she know about the global warming and some of the things like how much change for the temperature, how much will be the dengue effect, and so these are the questions mainly related with the adaptation and mitigation, and they have any preparation like the climate change adaptation and mitigation, like what kind of source they have used for the climate change news, the news coverage. So this is also important because so we have incorporated those of the things. Yes. But we raise hard questions for climate change, hard questions for dengue, and so total 90 questions. This is a long survey. We used a ODK app. So all the data surveyor or data collector were the medical health doctor, local medical health doctor. So there is no recall bias or personal bias. You may ask the question to me. So I use the statistical method to use the reduced bias. So no question of bias. I think the data is quite good to actual visualization of the cap level of these two countries.
I'm just not sure why it would help someone to manage their own risk of dengue to know about climate change. So can you explain to me what your mental model for that is? And why, if people have a limited space in their heads and their lives to worry about stuff, does it not make more sense for us to target information very carefully to people about the specific risk that they face currently, rather than trying to put it into this big picture of a global change? Second small point, I think you might, hopefully you've looked at this, but have issues with multicollinearity in your regressions, because rural education and socioeconomic characteristics, we would normally expect them to be highly correlated with each other. So be careful of your interpretation.
So for regarding to the first question, global warming and local climate change. We are emphasizing mainly the local climate change, but global warming.
Why does it matter that it's changed? Isn't it just climate variability?
So that will be the explain the land use and land cover. So we are interested in the vulnerability mapping. So the vulnerable population, the vulnerable location. So these are the main objective of my study. In fact, still now I did not start, but after collecting the data and the historical data, we will try to assess and quantify the vulnerability of the climate change and the dengue. So the local climate change is playing a major role over here. So the thing is it's totally related with the vector control. So if we want to make the awareness among the population about the vector control will be good. So they will have some preparation. It is called the early warning detection system.
But forgive me, but I think you're talking about climate, not climate change.
Yes, and you see that our data as well, the retrospective data, right? So we also consider the time series data as well. So we are considering the 20 years data as well. So that the particular change in temperature, particular change in humidity, particular change in rainfall, what amount of change in the dengue cases in our study? We are considering the changes in climate as well. This is the spatio-temporal modeling. My previous speaker is presented here. So we have a plan to also see the spatio-temporal distribution. That spatio-temporal distribution will, like the spatio means space and time. So with the changes in climate, I think our study will show something to you as well. And the second question is about the multicollinearity problem, right?
In my
multicollinearity,
I variability and stationarity.
I already checked the multicollinearity, and I have found some of the multicollinear variables, and already I detected and deleted from my model. So I need not to be aware from the multicollinearity in my analysis, because I already deleted based on the BIF, variance inflation factor. So I got the multicollinearity and I deducted those variables from my model. So there is no multicollinearity problem right now in my analysis, I think.
Okay, let's thank you, Siddikur, again. So, one more speech. So next speaker will be Ichika